नमस्कार, सत श्री अकाल, आदाब और खमा गणी दोस्तों। सुनाओ अपनी कहानी, बनाओ अपनी पहचान की इस खास मुहिम में आप सभी का स्वागत है। दोस्तों, कहानियों के इस सिलसिले को आगे बढ़ाते हुए आइए बढ़ते हैं आज की अगली कहानी की ओर। ये कहानी है डॉक्टर हितेश यादव की जिंदगी की सफलता के बारे में, इनके अनुभवों के बारे में। जी हाँ दोस्तों, इससे पहले कि हम सीधा इनसे मुलाकात करें, आइए एक नज़र डालते हैं इनके अब तक के इस खूबसूरत सफ़र पर। तो आपको बता दें, डॉक्टर हितेश वर्तमान में उदयपुर के GBH अमेरिकन हॉस्पिटल में बतौर कंसल्टेंट कार्डियोलॉजिस्ट कार्यरत है। दोस्तों, ये हृदय संबंधी बीमारियों का उपचार करते हैं। इनका मानना है कि डॉक्टरी पेशा एक जिम्मेदारी वाला पेशा है। ऐसे में इस पेशे को बहुत ही गंभीरता से लेने की ज़रूरत है। जो कोई भी इस पेशे को अपनाना चाहते हैं, उनके लिए इनका यही सुझाव है कि उन्हें पहले एक अनुभवी चिकित्सक के अधीन प्रैक्टिस पीरियड में जितना संभव हो उतना अनुभव प्राप्त करना चाहिए। साथ ही इस पेशे में चिकित्सा ज्ञान का भी इन्होंने अत्यधिक महत्व बताया है। दोस्तों, ये तो हुई इनके प्रोफेशन की बात। अब अगर बात करें इनके प्रारंभिक जीवन की, जी हाँ, इनके करियर के उस शुरुआती दौर की, तो आपको बता दें, अलवर में जन्मे डॉक्टर हितेश बचपन से ही डॉक्टर बनने के सपने के साथ बड़े हुए। फिर उदयपुर शहर से इन्होंने अपनी स्कूली शिक्षा प्राप्त करने के बाद अपने सपने को पूरा करने के लिए मेडिकल की परीक्षा दी और ये जवाहरलाल नेहरू मेडिकल कॉलेज में MBBS के लिए सिलेक्ट हो गए। MBBS पूरा करने के बाद इन्होंने सरदार पटेल मेडिकल कॉलेज बीकानेर से MD की पढ़ाई की। साथ ही अपनी PhD और त्रिवेंद्रम मेडिकल कॉलेज में प्रैक्टिस भी शुरू की और इस तरह इस पेशे में कदम रखा और आगे बढ़ते बढ़ते आज ये मुकाम हासिल कर लिया। दोस्तों, इनकी प्रोफेशनल और पर्सनल लाइफ के बारे में और करीब से जानने के लिए आइए अब सीधा मिलते हैं इनसे और सुनते हैं पूरी कहानी सिर्फ और सिर्फ इनकी अपनी जुबानी।
Myself Dr. Hitesh Yadav. I'm consultant cardiologist at GBH American Hospital. We are doing all kind of cardiac emergencies, including coronary interventions, device, and pediatric interventions. In the primary school only, I had an idea to be a doctor, and after getting into MBBS and becoming cardiologist, it was influenced by the teacher. They have taught us. So it's all about serving humanity. So we have seen that very excellent teachers. They have got very sound clinical as well as practical knowledge. So it has been generally we have learned a lot of lessons from the teachers. I was born in Alwar, Rajasthan, and that my primary schooling till 12th was from my hometown only. After that, I did my MBBS from JLN. After that, MD from Sardar Patel Bikaner, and afterward DM from Chitra Trivandrum. This is in my childhood we used to play outdoor games only. We had one large company of friends, so we usually spend our time outside only, playing, reading, and interacting the friends. It's just opposite of what we see today. Actually, that getting medical degree is a difficult task. That firstly, it is duration is pretty long. So to become a postgraduate, usually it takes something like 10 years. So now it's a digital media. In our time, we used to read that hard copies only. So that time there was no soft copies available. So that we have to be in the library for reading, or because getting all the books purchased was difficult. But now it is relatively simpler that because of multimedia and so many devices are there, and books can be on devices, so we can carry those almost all medical books in a device. When COVID started, it was everywhere. It was fear. So in general public, even in medical professional. So we cope with that. We were getting cardiac patient continuously, and preferably we were doing the cardiac intervention only. But in some unsuitable patient were undergoing thrombolysis. And above this, even the patient with COVID was coming primarily with the pulmonary manifestation. So those patients, some of those patients were getting that cardiac issues like acute coronary syndrome. So for that we use our judgment and we treated the patient. And during the COVID era, that our fear was about we should not give the infection to the family. So in that way we were isolated. So going home and being in a room only. So that was a difficult time. As we know that severe manifestation of COVID was seen in the patient with comorbidities. Comorbidities, whether it is diabetes, respiratory illness, or cardiac illness. So that any patient with advanced age 60 plus who were coming with the comorbidities, they were the most sketched patient we have seen. So the patient with pre-known cardiac issues, we manage conservatively, even if during the course of the disease, if something acute cardiac event happens, so we try to manage it with the intervention or with the medical treatment only. And most of the patients recovered with the treatment given. That the patient which could not be revived was primarily because of late presentation of the patient. Yeah, post COVID definitely some people are using precautions. Definitely dietary modification. Now people are having a more healthy diet and they are adopting a healthy lifestyle. So definitive changes are there. Even now the patient who are having even mild symptoms or the start of symptoms, they are directly coming and consulting rather than they are delaying their symptoms and or presentation to us. It was given me motivation to be a cardiologist and especially the dedication part for the patient I learned from my C Chitra teachers, Kerala. And on the personal front, that my motivation is my family. Yeah, definitely education play an important role. But just as I grow up, that just knowing the swimming and going into the water is not logical. So definitely we should know what we are going to do, what we are in terms of my profession. So we should know how to treat a particular illness patient, particular patient with a illness. So and with the years we see the different modalities of treatment and getting the more information about the disease as the medical science is advancing. One should be sincere to the studies because that basic knowledge what we get is during the MBBS. So they should study well and they should have very sound clinical knowledge that can be gained with the attending all the classes, getting all the clinics, and during PG that doing that clinic task and seeing the patient, examining the patient is very important. And definitely that read more and more, and preferably that standard books, reference books should be read. And after that, try to keep ourselves updated with the knowledge and keep gaining that clinical sense. And for whomever it is applicable, try to work at some good center and gain as much as clinical or practical experience possible. Yeah, being a doctor, we almost every day face different kind of personalities in terms of patient. So, but definitely we are almost all the time we are soft spoken. We try to understand the patient issues and we stay humble and just speaking politely and listening the patient to carefully make the patient confident. I think I like my life to fullest, but still, if I get the chance to, I would like to re-enjoy my MBBS time and more fun with the friends. Yeah, that apart from this professional front, I like definitely the family part. I like to play with my kids. I like outings with my family, and definitely I like the morning walk very much. Preferentially some at quiet place. I like to do motivation. I like meditation and yogas and some physical activity at home and outside. My life mantra is do reading, do physical activity, eat well, do exercise, have some sun exposure, spend time with the family, and do meditation, keep calm, and stay happy. Yeah, life is pretty long, so don't take things too seriously. Stay calm, stay happy. That's all. So I would as a doctor, I would like to advise rather one should keep the things simple, in terms of diet, take simple diet and do lot of exercises, do meditation, and so that in this stressful situation and particularly during this COVID era, so that keeping these 2-3 things can keep us healthy. Thank you for watching this video. To watch more videos, please download work more.
दोस्तों, आप सुन रहे थे डॉक्टर हितेश यादव की सफलता की कहानी सिर्फ और सिर्फ इनकी अपनी जुबानी। ऐसी ही प्रेरक कहानियां रोजाना सुनने के लिए हमारा चैनल सब्सक्राइब करें और बेल आइकन जरूर दबाएं। और अगर आज की ये कहानी आपको पसंद आई है तो इसे लाइक, कमेंट और शेयर करना ना भूलें। अब आप भी बन जाइए भारत की प्रोफेशनल कम्युनिटी की आवाज़ और सुनाओ अपनी कहानी, बनाओ अपनी पहचान की इस मुहिम से जुड़कर अपने जीवन के अनुभवों, करियर यात्रा, अपने उत्पादों एवं सेवाओं के पीछे की वास्तविक कहानी से देशवासियों को प्रेरित करें और अपनी एक नई पहचान बनाएं। Tell your story, inspire and build your brand with the power of video. जय हिंद, जय भारत।